Hello, Easy Note Doctors. This is Dr. Sean Tompkins with another training video. In today's video, I'm going to give you some tips as it relates to Medicare and treatment plan. So we'll go ahead and get started. Select treatment plan, select your patient, and you notice I have an extra button here for Medicare. If you have my customizations, you'll have this, and this is a really good statement that helps show Medicare what you're doing with the treatment plan. I'm not going to give this away. You have to get my customizations for it, but it's a very good statement. I got it from such gurus like Dr. Ron Short, Dr. Evan Gwilliam, and Kathy Mills Chang. So it's a really good statement that I have right there. But we'll just say symptomatic, and you want to enter in how many visits they'll need, 3 times a week for 4 weeks. This is the diagnosis the patient has. I'm not going to change that. They had a problem with their sacrum and with their neck. And then you want to select your techniques, any modalities, any exercises. I'm not going to do any of that. I don't do therapeutic or acupuncture. But I'm going to say yes to ADLs. Go ahead and select the things that you want the patient to avoid. And then the next one is, here's our goals for the treatment. This is where I spend some time thinking about, okay, what do I want to do for the patient? So you have to think a little bit on this one. So how much discomfort do I think I can get them out of within those 4 weeks? So we'll go a little bit higher there and say 70%. And then I've got customizations here that I've come up with. And so I'm going to select the thermal scan. I want to see improvement with their thermal scan. I want to see improved mobility, decreased muscle spasms, and palpatory tenderness. And if you have Medicare patients, make sure that you are having them fill out oswestries, because this is where you're going to get help you get your goals. Since this patient had neck pain and a sacral problem, I had him do both of these. So we'll just go ahead and go through those. Select the goals that you want to achieve. And there you have it. So these are your golden buttons. This is going to help show Medicare that you're getting functional improvement. And remember, that's what they're looking for, is functional improvement. So we're going to end this here, hit done. And then I'm going to give you a few more tips here. Medicare also wants a date of when you're going to end. So just give them a date. And then they also want a date when you're going to start care. So you can say, the treatment plan begins with today's visit. Or you can give them, the treatment plan begins with, and you can give them this date. In my Medicare statement, it has a date, it'll have a date in there, which will basically say, treatment begins with today's visit. And the next little tip I want to show you here is, I got this one from Dr. Evan Gwilliam. It's a diagnosis statement. So all this right here, I'll highlight it in blue. I got this from Dr. Evan Gwilliam. Now his is longer than mine. Mine's just a little brief summary of what's going on with the patient. So the first part is, where is their subluxation? Well, the patient's subluxation's in the cervical and sacral. So we're going to take these other regions out. And then you want to, what is the condition? What condition do they have? Well, this particular condition is cervical spondylosis and sacral spinal instability. And we're going to delete the muscle spasms. And then the next part of the sentence, it's going to describe, well, does the patient have any complicating factors? So any kind of complicating factors you want to add in here, like diabetes, degenerative disc disease, herniated disc, spondylolisthesis, stenosis, just whatever complicating factor that the patient has, you want to put it in here. Because basically what you're saying is, they may need more time for recovery, which makes sense. And we'll tidy this up here. And take out the S. So we got our complicating factors in here. That's communicating with Medicare that they may need more treatment and time of recovery. And then the last part is what's the mechanism of why they needed to come in today. So if they had a slip and fall or any other injury or any kind of just whatever made them come in today, you want to put the history there. And usually the patients will say, "Yeah, I twisted wrong or slept wrong," or so. You want to give a little bit of a history as why they're seeking treatment, and then we follow up here. The patient is now in active care. So there you have it. There's a few tips for you to help you with your treatment plans. I wanted to give you a heads up too that coming October 1st of this year, Medicare is really going to start ramping up audits again. So now is the time to get your documentation in order. And if you need help, be sure to check out the gurus, the guys, the people that know about this stuff, like Dr. Evan William, Ron Short, Kathy Mills-Chang. And if you need some help with your Easy Notes, I have some customizations that will help with your documentation. I've had 3 records requests, and it never led to any audits or any repayment of funds. Back in December of last year, Medicare didn't pay on some visits on a patient, and I appealed it, and then I think with all the stuff that I've got here in my customizations, I won my appeal. So I did get paid on stuff that Medicare said, well, you ran out of visits. I can't remember the reason. Oh, it was a diagnosis. They said I only had so many visits for that diagnosis, but the patient had more visits. Anyway, they cut me off too soon. I showed them all of my documentation, and they still denied it, and I appealed it, and from a company down in Florida, and they said, okay, you're right, we need to pay this. So anyway, my customizations, I believe they'll help you. If you want to know more about my customizations, go to News to Use, number 293 on 5/6/16. There's a link to my customizations video, intro video to that. Or you can call my office, 870-368-5690. And as always, be responsible, keep studying and following the Medicare and insurance requirements for your state. Hope this video has been helpful, and thanks for watching.